Yes. Hello, everyone. I'm glad to be here today to present to you our study on undernutrition in elderly people in Lomé. This work was carried out with Dr. APETI and Dr. Sodjehoun. I'm Kevin Ikusoso from Internal Medicine Department of Sylvanus Olympio University Medical Center. I have already had the privilege to present this work in France and certain African countries, but this is my first time present it in English. So I here hope to explain the cultural aspect of undernutrition in our African context among elderly people. To achieve our goal, here is the plan that I have to follow. First, into introduction, in which we will talk about epidemiology and certain aspects of undernutrition. I will present the methodology and the result, which will be discussed according to the data in the literature, and then we end up with a conclusion. Undernutrition is an imbalance between the body's protein energy intake and requirements. It is a frequent geriatric syndrome, which is easily diagnosed based on parameters such as weight, body mass index, the mean nutritional assessment score, and albumin checkup. Undernutrition leads to worsen state of fragility or dependence and increase the risk of death. We know it was necessary to present some important statistics about our country. Togo is a West African country with an estimated population about 8,400,000. The elderly represent 5.5% of the population, and according to the World Health Organization, an elderly is defined as people aged from 60 years old, and the life expectancy is about 62 years. About epidemiology in some European countries, undernutrition among elderly people varies from 15 to 38 among aged people and 30 to 17 in hospitalization. In her study in Africa, the undernutrition varies from 13 to 36% at home. The purpose of our study is to describe the epidemiological profile of undernutrition in elderly people attending to medical consultation at the hospital in Lomé, describe the clinical and biological aspect of undernutrition, identify the risk factor associated with undernutrition. The study was carried out at the Department of Internal Medicine of Sylvanus Olympio University Medical Center and the Gamesu Medical Clinic from November 2017 to January 2020. All patients aged from 60 years old admitted to medical consultation in medicine department were screened to determine nutritional status using the full version of the mini nutritional assessment. Only patients who had a biological checkup with albumin were included in our study. Here is an example of full version of the mini nutritional assessment. The mini nutritional assessment classifies patients into 3 categories: normal nutritional status, risk of undernutrition, and undernutrition. We use the criteria of the French National Authority for Health of year 2007, even if there there is a new criteria for year 2020, which classifies undernutrition into three categories: undernutrition and the severe undernutrition, taking into account weight loss, body mass index, the mean nutritional assessment score, and abdomen checkup. During the study period, 805% were seen in medical consultation and screened by mean nutritional assessment, while only 200 have abdomen checkup in the biological analysis. It represents 24% of the patients seen in medical consultation during the study period. Women accounted for 61% of our respondents. It represents a predominance of women as in most international studies. The age of response ranged from 60 to 99 age group. Between 60 and 75 was in the majority with 40%. According to the mean nutritional assessment, only 13% had a good nutritional status. 51% were at risk of undernutrition, and 36% were in undernutrition. According to abdomen checkup, 41% were in undernutrition. According to the nutritional assessment, women were more in undernutrition than men. According to the statute, according to nutritional statute, among patients who were in undernutrition, according to the mean nutritional assessment, most had a loss of appetite, were on restrictive diet, not eat meat, and did not include dairy products in their diets yet. And it was the same thing for those with low abdomen in biologic analysis. Our results deserve to be discussed with the literature data. Our study has many limitations. First, the lack of biological analysis. Undernutrition is often associated with vitamin and mineral deficiency. The cause and unavailability of biological analysis in our country. For example, it costs $200 to do such biological analysis, but in our country, the SMIC is about $100, and there is no health insurance. And then Togo has only just one geriatrician in office since September 2019. In West Africa, the World Health Organization defined an elderly person as being aged from 60 years old, which corresponds to retirement age. And given that life expectancy is about 62 years, but in our study, the age of our patient varied from 60 to 99. And we have 15% of our patients who were over 85 years old. According to the mean nutritional assessment, 51% of our patients were at risk of undernutrition, and 36% were in undernutrition. It is the same result in some studies in other countries in West Africa, for example, Senegal. in Senegal, and even some European countries such as in France. In our study, we found out that restrictive deaths in the elderly increase the risk of undernutrition in our social cultural environment. The elderly practice a voluntary dietary restriction based on dogma that have no scientific basis. For example, it says in our African context that elderly people don't consume milk, don't eat a lot of egg, and this information is reinforced by social media without any reliable source. In addition, the lack of nutrition specialists and dietitians creates a vacuum in the prevention and care of these patients in undernutrition. To sum up, undernutrition, which is underestimated in geriatric, must be a concern for health professionals. The proportion of elder people increasing and the absence of reliable epidemiological data has motivated this work. The mini nutrition assessment and the abdomen checkup should be used for a better evaluation of undernutrition history. Undernutrition. Restrictive diet based on dogma are significant risk factor associated of undernutrition in our cultural context. So we are at the end of our presentation. Thank you for your attention.